Doctor, I've got chest pain. Can you handle that sentence in fast, natural English at B2 C1 level, in OET, or real emergency room? Today you will train your chest pain history so it becomes automatic, not textbook, but real consultation English under pressure. You'll first watch a full emergency chest pain consultation, then break down 10 killer phrases, and finally do a speaking challenge that 99% of medical English learners avoid, but that changes everything. Watch until the end, speak out loud, and get ready to comment your answers and watch the next training video. Part 1. Full Role Play. Emergency Chest Pain History.
Hello, I am Dr. Lee, one of the doctors in the emergency department. I've been told you're having chest pain. Can you tell me a bit more about that?
Yes, I started getting pain in my chest earlier today, and it hasn't settled.
All right, let's take this step by step. First, can you show me where you feel the pain most strongly?
It's right here, in the center of my chest.
Thank you. And when did the pain first start?
It began around 6 this morning.
Since it started, has it been there the whole time, or have there been moments where it eased completely?
It never fully went away. Sometimes it feels worse.
How would you describe the sensation? For example, does it feel tight, heavy, sharp, or burning?
More like pressure, a heavy feeling.
At its worst, how severe does the pain feel, from 0 to 10, where 0 is no pain and 10 is the worst pain you can imagine?
Pretty bad. I'd say 8 out of 10.
Does this discomfort move anywhere else, for example, to your arm, jaw, back, or neck?
Yes, it goes down my left arm and into my shoulder.
Have you noticed whether being active, like walking or climbing stairs, makes the pain worse?
Yes, walking definitely makes it worse.
And when you rest, does it improve, even a little?
A little, but it doesn't disappear.
Since the pain started, have you had any of the following: difficulty breathing, feeling sick, cold sweats, feeling faint, or pain in your jaw or back?
Yes, I was sweating a lot and felt short of breath.
Have you ever had anything similar before, even if it was milder?
No, this is the first time.
I'd like to ask a few questions about your general health and risk factors. Do you have any long-term medical conditions, such as high blood pressure, diabetes, or high cholesterol?
I have high blood pressure.
Are you on any regular treatment for that?
Yes, I take tablets every day.
Do you smoke or use any tobacco products?
Yes, I smoke.
Is there any family history of heart disease or sudden heart problems, for example, a heart attack in a young age?
My father had a heart attack in his 50s.
Thank you, that's very helpful. Based on what you've told me, we need to assess this urgently. I'm going to examine you now and arrange some immediate tests, including an ECG and blood tests for your heart.
In a moment, we'll break down 10 high-value phrases from that consultation. If this is already useful, pause for a second, hit subscribe, and then come back for the phrase breakdown and the final challenge. Part 2. Language Breakdown. 10 Killer Phrases. Now let's sharpen the language. These phrases make you sound like a real emergency doctor, not a textbook. 1. Can you tell me a bit more about that? Invites the patient to speak without sounding like an interrogation. Buys you a few seconds to think and organize your clinical questions. Repeat after me, out loud. Can you tell me a bit more about that? 2. Let's take this step by step. Reassures an anxious patient and slows the interaction. Shows that you're calm and in control in an acute situation. Repeat. Let's take this step by step. 3. Can you show me where you feel the pain most strongly? Asking the patient to point improves accuracy and avoids confusion. Most strongly sounds natural and precise at B2 C1 level. Repeat. Can you show me where you feel the pain most strongly? 4. Since it started, has it been there the whole time? Tests persistence versus fluctuation without sounding robotic. Avoids overly technical language like continuous versus intermittent. Repeat. Since it started, has it been there the whole time, or has it eased at any point? 5. How would you describe the sensation? Sensation is a powerful word, better than repeating pain endlessly. Add simple descriptors like tight, heavy, sharp, burning, stabbing. Repeat. How would you describe the sensation? 6. At its worst, how severe does the pain feel from 0 to 10? Focuses on peak severity, which examiners love. Sounds safe and clear for OET and real patients. Repeat. At its worst, how severe does the pain feel from 0 to 10? 7. Does this discomfort move anywhere else? Discomfort and move sound softer and more natural than radiate. You can then add examples like your arm, jaw, back, or neck. Repeat. Does this discomfort move anywhere else, like your arm or jaw? 8. Have you noticed whether being active makes the pain worse? Tests exertional chest pain without using heavy jargon. Works perfectly for history taking and for exam role plays. Repeat. Have you noticed whether being active makes the pain worse? 9. Since the pain started, have you had any of the following? Organizes red flag symptoms clearly in the patient's mind. Helps prevent long, unfocused answers. Example. Since the pain started, have you had any of the following? Breathlessness, sweating, feeling missing, or feeling faint. Repeat that whole sentence out loud. 10. Based on what you've told me. Signals clinical reasoning and a transition to management. Sounds confident and professional without being arrogant. Example. Based on what you've told me, we need to assess this urgently. Repeat. Based on what you've told me, we need to assess this urgently. Now you have the phrases. Next, you'll train spontaneous speech, thinking and speaking at the same time, just like in an OET speaking test. Part 3. Pause, think, speak. Advanced fluency practice. Pause the video after each patient line. Speak in full sentences in a clear, calm voice. Don't memorize. Think and respond. Ready? Let's go. 1. Doctor, I've been having pain in my chest since this morning. Clarify location and onset. Model answer. Can you show me exactly where you feel the pain and when it first began? 2. Patient. It's in the middle and it started around 6. Ask about the sensation and how bad it gets. Model answer. How would you describe the sensation and, at its worst, how severe does it feel from 0 to 10? 3. Patient. It feels heavy and it's very strong. Pause, then ask if it moves anywhere else and what makes it worse. Model answer. Does the pain move anywhere else, like your arm or jaw, and does being active, such as walking, make it worse? 4. Patient. It goes to my arm and walking makes it worse. Pause and ask about red flag symptoms. Model answer. Since this started, have you felt short of breath, sweaty, sick, or lightheaded with the pain? 5. Patient. Yes, all of those. Pause and ask about medical conditions and smoking. Model answer. Do you have any medical conditions, such as high blood pressure or diabetes, and do you smoke? Excellent. Now it's time for the final challenge, the part that really upgrades you from translation English to doctor English. Part 4. Final challenge. Speak like a doctor. In this challenge, you will choose between 2 options each time. One sounds like a real doctor, the other sounds overcomplicated or unnatural. After each patient line, pause the video. Say your full answer out loud. At the end, write your answers in the comments. Ready? Let's start. 1. Patient. Doctor, I've had chest pain since early this morning. Which would you say? A. Please specify the precise onset of your symptoms. B. When did the pain first start? 2. Patient. It started around 6 and hasn't really gone away. Which sounds more natural? A. Has the pain been persistent since then, or has it settled at any point? B. Is the pain chronic or acute in nature? 3. Patient. It feels like pressure in the center of my chest. Which would you use? A. Does this sensation extend anywhere else in your body? B. Is there any radiation to anatomical sites? 4. Patient. Yes, it goes to my left arm. How do you move forward? A. Have you experienced associated symptoms such as dyspnea or diaphoresis? B. Have you felt short of breath, sweaty, or unwell with this? 5. Patient. Yes, all of those. What's your next step? A. Based on this information, we will proceed with further management. B. Based on what you've told me, we need to assess this urgently. 6. A patient presents with acute chest pain. Which sounds more natural? A. I was informed that you present with chest pain. B. I've been told you're having chest pain. 7. You want to ask about radiation. Which would you say? A. Does the pain radiate to any anatomical locations? B. Does the pain move anywhere else, like your arm or jaw? 8. You want to assess exertional symptoms. Which sounds more like real clinical English? A. Is the pain exacerbated by physical exertion? B. Does the pain get worse when you're active? 9. You want to assess severity. Which sounds safer and clearer? A. How intense is the pain subjectively? B. At its worst, how severe does the pain feel? Write your answers to questions 1 to 9 in the comments using letters only. For example, 1B, 2A, 3A, etc. Now your medical English is already working for you, not against you. Write medical English exam you're preparing for and your country in the same comment. You will see other doctors and students training with you. Don't let today be the only day you train your medical English. Subscribe now for more videos. Your very next step, watch the pain, types of pain, how to ask about pain video, and cardio symptoms part 1 and part 2. The links are on screen and in the description. See you in the next consultation. Follow Medical English Pro.